Hi, I'm Louise Haynes, and I'm going to be spending the next couple of minutes introducing you to an article that you will be reading on talking to your clients about sex. This is an article that we published in Counselor Magazine a few years ago. Don Cowson, Susan Tross, and I are co-authors of this article. And we were interested in writing this article because of our experience in implementing a randomized clinical trial in community treatment programs. The purpose of the trial was to determine the effectiveness of a gender-specific group intervention to decrease sexual risk behavior among people in substance abuse treatment. And we discovered through implementing the trial that many counselors are just not comfortable and don't feel trained, don't feel confident in their abilities to discuss sex with their clients. And as a result of that, often the issue of sex and the connection between sex and drugs is not discussed with clients as part of therapy. And we felt that this was a need for counselor training, and our interest in writing the article was to try to fill some of that void. So some important points in the article that you'll find is some discussion about the sex-drug connection and the way that a person's use of drugs and sexuality can become intertwined, and therefore their recovery has to also include discussion about the sex-drug connection. You'll also find information about assessment, what questions to ask, and how to ask the questions in order to understand your individual client's needs regarding sex and drugs. You'll find a list of some available resources that you can use to increase your knowledge in this area, and some discussion about counselor training. So there are a couple of takeaway messages from the article. One is that issues about sexuality and substance abuse treatment is not just about decreasing an individual client's risk for HIV. Sex is both an issue for relapse and a recovery issue that clients would benefit from understanding more about how sex and drugs are connected in order to have a successful recovery and to avoid relapse. So this is the cover page of the article, and here's the link so that you can access the article. I hope that you will find it informative. Thank you very much.